A pediatrician in Utah described the recent upsurge in measles this way, quote, "When children come in, they're often bent over. We call it tripoding, which is particular to upper respiratory infections and airway swelling. The kid is hunched over, mouth open, drooling, crying, maybe not even producing tears because they're so dehydrated. Really labored breathing, kind of tugging in their belly, tugging between their ribs. Their eyes look kind of glazed over. It's like they're seeing through you." Measles is a highly contagious virus, and before the measles vaccine became available in 1963, 4 million people caught it a year. It's particularly dangerous for children under 5, but by the year 2000, the U.S. had declared measles eliminated. But now an anti-vaccine activist controls the levers of America's public health system. Health and Human Services Secretary Robert F. Kennedy Jr. has canceled funding for the development of mRNA vaccines. He's tightened access to COVID vaccines. He's attempted to overhaul the childhood vaccine schedule, though that move is being challenged in court. The broader anti-vaccine push has had immediate consequences. Last year broke records, 2,289 confirmed cases of measles across the country. This year has already surpassed that. It's only July. 2,318 people have been diagnosed with measles through mid-July. Now, what's really worrying is the vaccine coverage rate for measles, specifically among children entering kindergarten. The magic number for what you know of, we talked about this during COVID, of herd immunity is 95%. If 95% of people in a community have the measles vaccine, then they are protected by herd immunity. This is the CDC map of vaccine coverage for kindergartners in 2019. This is the year before the COVID pandemic. All of these teal states are states that have hit the magic 95% herd immunity figure. The clay-colored states are just shy of the magic figure, but enjoyed at least 90% vaccine coverage, which is pretty good. The red states, and there are only 3 of them that you can see here, fall below 90% of vaccine coverage. Okay, this is 2019. Let's go to 2025 now over here. Look at the color change. The coverage rate has dropped across the board. In Utah, coverage dropped from 93% down to 88%, now has the second largest measles outbreak in the entire country. Take a look at this. There are only a handful of states now that have that 95% coverage rate. Joining me now is Dr. Deborah Howry. She's a physician and former chief medical officer and deputy director for program and science at the Centers for Disease Control and Prevention. She resigned in protest last summer after HHS Secretary RFK Jr. fired the CDC director, Dr. Susan Monarez, over vaccine policy disagreements. Dr. Howry, thank you for joining us. So we appreciate you being here.
My pleasure.
I don't know, because I'm not a doctor, a researcher, or a scientist, what to overstate or understate here. We only have numbers that tell us things that we should understand, and that is measles was a disease that was eradicated in the United States. Now, more than 3,000 people have contracted measles this year. If you're a child and you can't be fully vaccinated against measles, and there isn't herd immunity around you, you could die.
Yeah, and, measles, I think there's just been a really kind of a misconception that it's a harmless childhood disease. People talk about the Brady Bunch having had it, but, we know that children are hospitalized with it. People can die from it. And even after you recover from measles, years later, people can die from a brain infection and their immune memory gets wiped out. So it's a really concerning disease. And this is not a record that we want to be having. We've set a record now for the highest number of measles cases in decades.
And so I tend to not use the word vaccine skeptics, because I think skepticism is a necessary part of science and sometimes a healthy part of science. This is weird. This is something entirely different. If you aren't certain that vaccines are safe or doing what you think that they're doing, I would think the thing you do, which would get you the biggest return on investment, is further research, not canceling research, as we've done for mRNA vaccines.
No, I agree. I think, certainly, if we have a pandemic or another, unknown outbreak, you want that research for new vaccines. The other thing that's different is usually we have health leaders speaking about the importance of vaccines when there are outbreaks. And, the secretary has misspoken about the measles vaccine, saying it has fetal parts in it. and really promoting unproven treatments like steroids and antibiotics instead of the vaccine.
Now, there have been criticisms from this administration about the CDC and how it's run, and I'm sure any major organization would face criticism. There is a school of thought that organizations like the CDC are a gold standard in terms of surveillance, in terms of research, in terms of there being illnesses that just don't get going in the United States because we're able to catch them. Again, it feels like bad practice, right? I think you can have your views about medical science, but when you start dismantling the infrastructure about this could have effects for decades to come.
Yeah, I think we've seen that with, about 30% of the workforce being cut, 80% of senior leaders at CDC being gone. We're seeing now that we're not able to track foodborne outbreaks as much. And certainly if you can't have, visibility into other countries because we have withdrawn from the World Health Organization, we are not prepared for global health threats either.
Wall Street Journal is reporting about Donald Trump urging RFK Jr. to do more to cut back on childhood vaccines. I want to read from this piece. It says, chief among the president's desires, do more to reduce the number of shots that federal guidelines recommend for children, according to people familiar with the matter. They said the president hopes to then see autism rates drop, even if any such effect could take years. There's a lot in that two sentences that I just read. First of all, we've pretty much established that these vaccines do not cause autism, but it's a weird experiment, right? Run this experiment, vaccinate fewer people, hope that autism rates drop, and then what? Take credit for this in 15 or 20 years when you're not the president? I don't even understand what the thinking could be behind this.
I also think a lot of these natural experiments aren't very helpful. I mean, we look what happened, when Department of War took away the flu vaccine requirement, and we saw 300 soldiers not prepared and not ready, should they be needed, and got infected with the flu. And unfortunately, one person died, and that was preventable. Autism is a serious health issue in this country, and we need to study it seriously and not waste taxpayer funding on things that have already been studied repeatedly, like vaccines. We know that there's environmental triggers, that there's some genetic components, it could be infectious diseases. We need to really study this seriously and not go after things that have been really studied over and over. And, the secretary has said you shouldn't take medical advice from him, so the president should not be taking advice from him either. There is perhaps an understanding, maybe some of us learned it during COVID when we realized that there had been people studying this type of disease for decades and finally had an opportunity to make this into a workable vaccine. Things like that, things like NIH grants, these are some of the best uses of taxpayer dollars, perhaps of all. It's why we have longer lifespans. It's why we're able to get cures to diseases. But the average person doesn't know this, right? The average person isn't in a clinical trial. They don't know the things that are happening. They don't know the people who are working for 3 more hours in a lab tonight, hoping for a successful outcome. Have we done a bad job of communicating to people how crucial these medical research institutions are? I think we can always do better on how we communicate, and certainly CDC had many lessons learned on how to communicate differently during COVID. I think also when public health is successful, you don't
have to. Yes.
Diseases are prevented. And similarly with science, you may not see the results of a study, or preventing a new disease or a new vaccine for years. But that doesn't mean that important science isn't going to save lives.